that in mind today. So we're going to go ahead and get started. My name is Annie Long. I probably know some of you, so again, thanks for joining, but I am a Senior Community Program Manager with the Parkinson's Foundation. I've been with the organization on and off since 2013, actually after my mom was diagnosed with Parkinson's. So this cause is near and dear to my heart. So I want to go ahead and start by talking a little bit about the Parkinson's Foundation. Our mission as an organization is really to make life better for people with Parkinson's. And we do that by supporting people here and now, by focusing on research. And here in Georgia, we actually have a Georgia chapter. Hopefully you guys have been to our Georgia chapter page, which is parkinson.org/Georgia. But here in Georgia, we really focus on providing support and education to patients and families living with Parkinson's. We provide support to our 2 centers of excellence. We have one center of excellence at Emory here in Atlanta, and we have another center of excellence in Augusta, so at the Medical College of Georgia. And we also focus a lot on fitness here in the Metro Atlanta area. So we hope that all of you guys out there have been exercising. I know it's been tough during COVID, but hopefully you found some online fitness resources, or maybe you're even back in the boxing gym, but doing so safely. So definitely check out our chapter page so you can learn more about local fitness resources, educational opportunities, our Moving to Atlanta walk, which actually just happened a couple of weeks ago, and other free resources through the foundation. So again, hopefully you guys have been able to join us for our national programs through our PD Health at Home virtual program series. We actually offer programs every Monday, Wednesday, and Friday. You can get more information, sign up for upcoming events by going to parkinson.org/pdhealth. You can also watch archived recordings of any of our content, and it's fabulous. Really, every Monday you focus on meditation and mindfulness. Wednesdays, we hear from expert speakers, and Fridays, we focus on fitness. So definitely check that out. Here in Georgia, our Georgia chapter is hosting a program for newly diagnosed on Friday, December 4th, which I'm really excited about. This is actually our first program targeting newly diagnosed here in Georgia. So definitely sign up for that. It's really for people who've been diagnosed within the last 3 years, but even if you've been living with Parkinson's longer, or have a family member who has, still feel free to join us, because I think the information is going to be really informative and really helpful. It'll be a longer program. We're going to try to fit in a lot of information, some fitness demos and things like that. So definitely check it out, and you can register at parkinson.org/GA-NEW-DX. All right, an exciting opportunity I just want to briefly let you guys know about is our PD Generation Genetics Initiative. So this is something that the foundation has launched nationwide. We're working with some of our centers of excellence around the country to offer free genetic testing and counseling for people living with Parkinson's. Again, this is free, so this is definitely something that all of you should take advantage of. You can either go to one of our centers in person, or you can actually do this through telemedicine as well. We would just send you an at-home cheek swab test kit. So definitely go to our website for more information. This is very exciting, something that everybody should really be involved with. It can empower you and arm you with information about your genetics and any PD related genes that you might have. It can empower your family members, and it can also help researchers. So before we get started, I want to just quickly thank today's sponsors, Supernus, Amneal, Kyowa Kirin, AbbVie, and Accorda Therapeutics for their support. You can actually get more detailed information about our sponsors by visiting our Georgia chapter page. So the website is actually, I know Danielle's going to throw it in the chat, but you can go to our chapter page to learn more about all of these amazing supporters. Without our chapter supporters, we could not have programs. We could not do what we do as an organization. So we're really grateful for their support. All right, so now we're going to talk about why we're all here today. And we're here today to learn about some of the challenges that people with Parkinson's are faced with when they're in the hospital, whether it's for a planned hospital visit or an unplanned emergency. Today is really meant to sort of arm you with information. We want you to understand the risks that are involved, the challenges certainly that COVID-19 presents, and how we as an organization and how you and your families can really help advocate for better care in the hospital. Okay, so many of you guys probably know that for most people, the transition from hospital to home is the most challenging part, right? Leaving the hospital and having to go home and recover, that tends to be the most difficult part. But actually for people with Parkinson's, it's the opposite, right? Going to the hospital is incredibly challenging. So many of us think hospitals are safe, right? So these are kind of some of the things I know that many of us probably have, going through our heads when we're going to the hospital. Things like the people in the hospital are going to call my neurologist and keep them in the loop, about what's going on with me. The hospital pharmacy is going to have all the medication that I need, right? It's a pharmacy. How could they not? The staff at the hospital is going to understand my Parkinson's symptoms and, get me my medication on time. And they're going to understand what drugs to give me and which ones not to give me. So these are sort of the assumptions I think most of us make about hospitals. Unfortunately, the reality is a little bit different. One of the reasons that the Parkinson's Foundation has developed this Aware and Care initiative is because they found that 3 out of 4 people with Parkinson's admitted to the hospital are not getting their medications on time. Of those individuals, 2 and 3 have complications, often serious complications that result from those medication changes and errors. So the reality, we'll talk a little bit about some of these statistics. The people with Parkinson's are hospitalized more than their non-Parkinson's peers. People with Parkinson's suffer from complications at a higher rate than their non-Parkinson's peers, and this often yields longer hospital stays. So why is this happening? Well, even in the best hospitals, there's really a lack of understanding about Parkinson's. Many of us, especially here in Atlanta or in Augusta or, near any of our centers of excellence, are fortunate to have access to Parkinson's specialists. But the reality is that in many hospitals and clinics, there aren't Parkinson's specialists. Hospital pharmacies, don't necessarily stock all the Parkinson's medications that you guys may be taking. And then again, kind of something we touched on a moment ago, hospital staff really may not understand what types of drug interactions can be dangerous for somebody with Parkinson's. And this was surprising to me that 25% of hospitals, actually only 25%, have a mechanism in place to protect or to contact a person's Parkinson's doctor upon admission. That surprised me. I was always under the assumption that, if you have Parkinson's or a condition that needs very special attention, that your hospital staff would notify your doctor, especially if you ask them to. Another statistic that's a little bit grim is that 70% of hospital staff are actually unaware of drugs that can worsen Parkinson's motor symptoms or contraindicated, meaning that they can then really interfere with your Parkinson's drugs. So I think in general, what the foundation has found is that there's really just a lack of awareness. And that's one of the reasons, again, we're here today. We want you to become better advocates for yourselves and your family members. But we also would love for you to help us raise awareness about these important issues. Medication timing, I know we talked about a pharmacy may not have your medication, but there's also a medication timing issue. I think most hospitals and I would say there are probably a lot of them are understaffed. And so it's very difficult for nurses and staff members to give you, an individual, your medication exactly when you need it. They're working on a schedule and they're doing rounds. So things like that are really tricky in hospital systems. There's also, as we'll get to in a little bit, there are also some really common medications that are given, I think, to people admitted in the hospital, things that are given for pain, nausea, depression, and even psychosis that can be really detrimental for somebody with Parkinson's. All right, and as we all know, there are so many amazing providers out there, right? Even if they're not Parkinson's experts, they are there to care for you, and they're, certainly going to do the best that they can with the information that they have. But it's also up to us to help get them the information that they need regarding our Parkinson's. So let's take a look at sort of how people with Parkinson's enter the hospital, because I think this will give us a better idea of, how many errors, how much room for error there can be when it comes to people with Parkinson's in the hospital. So people with Parkinson's you generally enter one of two ways, right? If it's an emergency admission, you're working with first responders, ER nurses, ER physicians. If it's a planned admission for an elective procedure, let's just say, you're dealing with unit nurses or the, person with Parkinson's doctor. At any point, from admission, into when you're, actually seen by physicians, there are lots of people who are taking care of you, lots of people who need to know that you have Parkinson's, who need to know what medications are contraindicated, who need to know that medication timing for you is really critical. All right, so some of the challenges, again, related to dealing with somebody who has Parkinson's is, of course, that, PD may not really often be the primary reason that you're admitted to the hospital. And providers, who might be caring for you for something completely unrelated to Parkinson's may not be as familiar with Parkinson's and the complexities of it. Parkinson's medication regimens are complex, right? Many of us are taking multiple medications and we're taking them at very scheduled times. And then, of course, with Parkinson's, there's, mobility issues that make staying in the hospital even more challenging. All right, so some of the medication challenges, as we mentioned a moment ago, multiple medications are usually used to treat Parkinson's. So that's multiple medications that could potentially be misprescribed or not given to you at the right times or not given to you at all in a hospital. Contraindicated medications are often not recognized or even flagged, in a pharmacy system. So that can be really dangerous. And then any changes in times or dosing of the medication can really affect your status. And then compromised swallowing, can also make any new medication changes more challenging. All right, and this is just a quote that I think is really interesting, but it just goes to show how dangerous it can be, to have any changes to your medication or to the medication timing. But basically, anti-Parkinson medications are as necessary to a Parkinson's patient as insulin is to a diabetic. So acute discontinuation or, again, changes or giving you medications that are contraindicated can be challenging, but they can also be really life-threatening. In addition to medication challenges, somebody with Parkinson's obviously, is dealing potentially with some mobility challenges as well. So when you're in the hospital, and I know Dr. Hickenbotham is going to talk about this in just a moment, but when you're in the hospital, it is critical to try to, mobilize, to try to move, make sure that you're getting help if you need help moving. But, the longer, obviously, you're not moving, the more rigid you can become, the worse your symptoms can get. So it's really important to talk to your care partner, to talk to the nurses and the people who are caring for you, and make sure they understand that you have a movement disorder and you've got to move. All right, so without further ado, I want to introduce you guys to Dr. Higginbotham. Dr. Higginbotham, Dr. Lenore Higginbotham, is currently an assistant professor in neurology in the Movement Disorders Division at Emory University School of Medicine. She completed her medical school training at Emory and her neurology residency at the Johns Hopkins Hospital. She then returned to Emory for a 2-year movement disorders fellowship before joining the division as a junior faculty member. Dr. Higginbotham has maintained an interest in neurodegenerative research since medical school and is currently focused on advancing protein biomarker discovery among Parkinsonian disorders using advanced proteomics techniques. And I probably mispronounced that, so you can correct me if I did. So anyways, very impressive, Dr. Higginbotham, and we are so honored and thrilled to have you joining us today. And know that you appreciate this topic and know how critical and important it is, especially right now in the midst of COVID-19. So without further ado, take it away.
Great. Thank you so much, Annie, and hopefully you guys can hear me okay. As Annie just said, I am a movement disorders physician over at Emory University, where we do have quite a big movement disorder division and take care of many, many Parkinson's patients. And I basically volunteered for today's talk because I've been seeing a lot more challenges with our patients entering the hospital, particularly in the COVID-19 era, where there have been, restricted visitor policies and restrictions between the communication between care teams and care partners of patients. And so I'm, happy to do my part in whatever way I can to prepare my patients for a stay in the hospital. So I will be talking a little bit about the impact of COVID-19 on Parkinson's patients, kind of then reiterating some of the things that Annie pointed out about the challenges and giving you a little bit of information on how to prepare for these challenges. So just a little bit about COVID-19 and Parkinson's disease. So Parkinson's disease itself is a motor disorder affecting the brain, but it is not, a traditional immune compromising disease. And this is likely why there is currently insufficient evidence showing that PD in and of itself increases the risk of you contracting COVID. So as far as we know, PD doesn't lower your threshold for getting COVID, but what we do think is that individuals with PD, if they do get COVID, are expected to be at higher risk for complications of this disease, despite having a normal immune system. And why is that? Well, it's all these things surrounding Parkinson's disease and just the demographics of our population that make you more vulnerable for not handling this disease as well as other people. First of all, many of our patients do tend to be elderly, particularly above the age of 60, which is what the CDC considers a high-risk population for COVID-19 complications. Many of our patients are mobility impaired, and what may not be readily apparent is that your pulmonary health and lung health is actually pretty tied into your mobility and being able to walk and expand your lungs and move around. And so when our patients are mobility impaired, they are at risk for developing more lung complications in the hospital, particularly pneumonia. And of course, just being mobility impaired and then having a setback like a hospitalization makes our patients even more prone to quick muscle deconditioning, which is when your muscles just develop weakness just from non-use. And this can happen in just a matter of a couple of days of just being inactive in the hospital for our patients. And then, of course, the fact that our patients are elderly and just increases their risk of having comorbid medical conditions that just put them more at risk for not doing as well with COVID-19. So even though, our patients with Parkinson's, there's not enough evidence to say you're at greater risk of getting the disease, you are likely at greater risk of not doing well with the disease. And then what are just the effects of COVID-19 on Parkinson's patients, on the Parkinson's aspects itself? So we do have a little bit of data with this, and this data suggests that, yes, just having COVID-19 can worsen just the overall motor and non-motor features of Parkinsonism. This particular study was quite small, looking at just a handful of patients, 12 PD patients who developed COVID-19, and then they compared these to a larger subset of patients with PD who did not have COVID-19 and just looked at how they did over the same time period. And you're not at all expected to read this whole chart, but I just want to point out here, these p-values, the bolded ones indicate the categories where PD patients with COVID did significantly worse or significantly their outcomes were significantly different from the patients who did not have COVID. And these aspects that were critically affected were just overall disability. So over the same time period, PD patients with COVID just were more disabled in general. Motor fluctuations, which many of you may know as wearing off or dyskinesia were also highly affected. So patients with COVID just tend to experience more and worsen wearing off. And then a variety of non-motor symptoms related to PD were affected as well, such as sleep, mood, cognition, and urinary function. And so I know many of our patients are social distancing and doing really, really well in terms of avoiding COVID-19, but I also think it would be remiss to just not point out that the pandemic itself, whether you get the disease or not, is just likely having effects on our patients in general as well. As many of us know, Parkinson's disease does put you at risk for mood disorders like depression, anxiety, and as I explained to my patients, just not handling stress as well as you particularly would. And so this particular commentary piece was talking about some of the hidden sorrows and of just the entire pandemic itself and what kind of impacts it has on our Parkinson's population. And as they pointed out, the pathophysiology of PD puts our patients at increased risk of chronic stress, and further worsening this may be one of the various hidden sorrows of the pandemic. And then another hidden one, not so hidden to me, I think, because I've had a lot of patients experience this in general, but one, I always talk about exercise and like intentional exercise, but which is super important in Parkinson's disease, but a level below that is just being active on a daily basis, which is also very important. So even if you're not intentionally exercising, it's also important to just be generally active. And, with our patients staying indoors and not being able to just go out and about like they normally are, we've just had at least a lot of my patients, their physical activity has dropped off substantially. And, this can worsen motor function and motor outcomes over this time. So as Annie alluded to, have been really trying to promote people doing virtual exercise classes. I've actually been sending quite a few people back to physical therapy programs for those who feel comfortable. It seems, that many places are doing this in a safe manner. But for those patients who are more comfortable at home or don't necessarily need a physical therapy program, and who are a little bit wired at home, have YouTube access. There's a lot of stuff for free on YouTube that you can access to get to just be active at home. These are just a couple of the sites that I like to promote. LSVT, as you guys might recognize as big and loud programs. There's actually quite a few videos on YouTube that you can access. Cleveland Clinic channel has a lot of those. There's many chair yoga exercises for seniors, which is great. And these two are ones that my mom really likes and several of my patients really like, but channels that really have a ton of exercise videos that you can do at home. And I just want to, highlight that, we're entering our umpteenth month of this, but COVID does not seem to be going anywhere. This is just one of the counts from of Georgia cases where it looks like we're kind of entering what may be a third wave going into November here. And this is just a quote from the Georgia counts from the New York Times site, actually, where over the last about week, there's been an increase of 10% of daily cases from 2 weeks ago. So, please don't relax on your social distancing. Another general rule, outside more than inside. If you do need to venture out, and then wear your mask and hand hygiene. So if you suspect you have COVID-19, call your primary doctor. Please do not just, if you have mild symptoms, don't just show up at your primary care facility unannounced or medical facility unannounced. Call first, figure out how to get COVID testing if it's indicated. Try not to lie flat. Remember to expand your lungs as often as possible. If you do have emergent symptoms, which would include shortness of breath, blue discoloration, I mean, these are fairly obvious, or just any mental status changes along with respiratory symptoms. It's, our elderly population can have atypical manifestations. If you're concerned, just go to the emergency room. Some of my patients have also invested in pulse oxes too, that can monitor oxygen saturation. And that might be a helpful way of like kind of noticing a respiratory infection coming on. But either way, if you have any sort of emergent symptoms, please just go to the emergency room. And if you're in the hospital, request respiratory therapy. We'll get into some of this a little bit later as well. Other resources, if you're kind of concerned, not know what to do, I really do think your first line of contact should be your primary care physician. Please just definitely call them. But if you're just worried about whether your symptoms require testing, Emory Healthcare has a COVID symptom checker. You can go in and put your symptoms in this basically tool, and it will tell you whether you should be tested for COVID. There's also, Georgia itself has a COVID-19 hotline. So this is going to be a little bit of a reiteration of what Annie had said, but in any case, why might you visit the hospital during this time? Well, of course, you may have an emergency. You may have like sudden chest, jaw, shoulder pain. All of that can be a sign of a heart attack. Sudden shortness of breath, as we just discussed, outside of COVID, could be a variety of emergent complications. Sudden onset of new neurological symptoms, always concerning for stroke, or just severe anything with the abdomen, nausea, vomiting, diarrhea, and dehydration. And you may have elective procedures. These just don't stop operating during COVID. People need their joint replacement surgeries, their cataract surgeries, deep brain stimulation. Emory is doing, started those back up. We had a little bit of a hiatus like in April, May, but we've started doing those again. Spine surgeries, imaging studies, don't quit either. And of course, mammograms, colonoscopies, all your things for your basic maintenance of health. You don't want to skimp on either. So you may need to go to the hospital. And then, several of our patients may need other medication infusions, chemotherapy, hemodialysis, and things that you really just can't, stop. I want to reiterate the emergency situation. I know it's kind of scary going to the hospital during COVID, but please, 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 if you have an emergency, please go to the hospital. I think that this has gotten a little bit better in more recent months, but there are several reports at the beginning of COVID, like April, May, those months with the shutdown, where there were just huge delays in people reporting for stroke symptoms. And this was really concerning because the main phrase that we use for stroke is time is brain. So if you have a acute neurologic symptom, facial droop, weakness on one side, slurred speech, anything that's new and sudden onset, that is a surefire reason to go straight to your emergency room. There are precautions in place to help mitigate the risk of you contracting COVID. I just don't want you to be so scared of going to the hospital that you avoid it in case of emergency. So again, Annie already gave a really good introduction to some of these considerations, but these are the considerations that can make your hospital stay as a Parkinson's patient really, really tough. Okay, so, but if you consider them and are aware of them, you can be more prepared for them. And I think that's empowering. So one is you may not be able to have your care partner with you. And that can be really challenging. Oftentimes for our Parkinson's patients, the care partner is essential. They help you remember your medication times. They really help you just stay active and motivated. And so it's really hard not being able to have your care partner with you. This combined with the fact that our patients with Parkinson's disease are at higher risk of developing hospital delirium, these two things together can just be, create a perfect storm. And for those of you who are not aware about what hospital delirium is, these are like acute stages of confusion, psychosis that patients can experience when they get in unfamiliar surroundings like the hospital. And typically it'll lead to fluctuations of consciousness. So one minute, the patient may be a little bit alert and more clear than the next minute. But this is classic hospital delirium. And our patients with PD and other neurological illnesses, particularly if you have any amount of cognitive decline associated with your PD, can be really at risk for developing this. And one reason I say these two things together can create a perfect storm is because when you talk about management of delirium and Parkinson's disease, and this goes for like any hospitalized elderly person, or really anybody with delirium, but one of the key ways that we treat this table in this particular paper goes on for forever, by the way, but this is just part of the table. But one thing that we use to treat delirium in the hospital is we want to provide contact to familiar persons. Just having that familiarity and somebody to ground you can really help you, kind of stay oriented as much as possible in the cases of delirium or in case of avoiding delirium. And, usually our goal in the hospital when we recognize delirium is to encourage family involvement and encourage phone calls and rooming in of familiar persons. But, all of this during COVID has been, if not just completely stopped, very mitigated a whole lot. So, these two together can create a little bit of a perfect storm for development of delirium and worsening delirium if you cannot have access to your care partner. As Annie pointed out, like doctors and nurses, they want what's best for you, but Parkinson's disease is becoming so specialized. There's a lot of different medications. For instance, I did a fellowship in movement disorders, and that was 2 years where I basically got trained to treat Parkinson's patients and a variety of other movement disorders, but Parkinson's is our main one. And so I really do think I needed the bulk of those 2 years to really be able to offer my patients the best care. And so a lot of doctors and nurses in the hospital do not have that subspecialized training. And if they're not neurologists, they may have even less experience with PD and the importance of medication timing and dosing. And so it is important that you can educate your doctors and nurses in a nice way about your medication timing and be empowered to let them know how important it is. One thing I usually always have to educate teams in the hospital about, one of the major problems that comes up is, they'll put our patients on NPO or where they can't have anything orally, or those swallowing issues will come up and the levodopa is just stopped, which can be very dangerous and is just not good for our patients. There is orally disintegrating carbidopa levodopa, and I have gotten this implemented at Emory University Hospital. So in case, you're caught in that situation, just know that there is something that disintegrates on the tongue, and it comes in exactly the same formulation as regular carbidopa levodopa. So it's just a one conversion. And of course, if you're stuck with an NG tube or some other kind of way of getting access, carbidopa levodopa, the pills can be crushed and put through the NG tube or the PEG tube or whatever is being used to give you nutrition at the time. Just some other considerations. Again, reiterating what Annie said, that nurses often care for about 5 to 7 patients at one time. These are regular floor nurses, all of whom have complicated medication administration regimens. At most hospitals, nursing handoffs are usually at 7 a.m. and 7 p.m. And literally there's like an hour around that time where, medications aren't are usually slow or not delivered. So if you have a schedule that requires you get levodopa around handoff times, it may be delayed. Hospital pharmacy formularies do not carry certain PD medications. This is very true of things like the newer ones, Rytary, droxidopa, Nuplazid. And so it's always good to bring your pill bottles with you to the hospital because you may often have to provide these medications yourself to the nursing staff to be given to you. And then the hospital may not have access to records from your neurologist, okay, or a direct way of contacting them. So as Annie mentioned, this not even at Emory is this a standard thing. I mean, it's shocking, right, that they just don't contact your neurologist, but oftentimes you have to ask and provide the contact information yourself. So how to prepare for hospitalization. So please research your hospital's visitor policy. For instance, Emory just updated theirs as of October, and I'll talk to you a little bit about that in a second. But be familiar with who can come and who can't, and who can be involved in your care, and how many people that can be, and who can stay overnight and who can't, right? Be prepared to educate your medical team about PD. Can't say this enough. You're going to hear from Hajan in a bit about resources that the Parkinson's Foundation has for you to be empowered. And I was looking over it, and I really like that letter that you can give to your doctors to sign, but it has some of the most key things, including about MAOBs. And remember, like, if you're having a procedure, it's not, you still need your levodopa. So it's really, we don't really hold it before or directly after the procedure. You should be getting your dopaminergic medications as regularly as you can surrounding. The only medication that we ask people to hold for their surgeries are MAOB inhibitors like Azilect or like Rasagiline or Selagiline prior to the procedure. Okay, so bring a detailed medication list and associated bottles. Cannot say this enough. I have been trying to do a better job of this during COVID. But even if you go to, like, for say, an Emory facility, they often will use whatever is in the chart or export your medication list from your pharmacy. And we're all a little bit bad about this, as even Parkinson's disease doctors. We change the levodopa doses so much, or we'll like make small changes, but we won't necessarily change the script. Okay, so I've been trying to be much better about this, making sure that the script matches exactly what we said we're going to do in the hospital. But like, this is why you need to bring a medication list with the current up-to-date how you're taking your levodopa. If we just switched it from Q5 hours to Q4 hours, if you just upped one dose to 2.5 instead of 2, like, have that information at your fingertips. And the associated bottles are always helpful, just in case you do have to provide your own medication if you're on something that's non-formulary. Have information on your healthcare power of attorney and emergency contact on hand. Bring your cell phone and charger. Really helpful for communicating with people outside if possible. Choose hospitals affiliated with your neurologist practice, and talk to your neurologist ahead of time about what kinds of changes. So even if you don't anticipate going into the hospital, it's always okay to ask me, like, well, if I did go in the hospital, is it okay if they just completely stop my levodopa? And I'll be like, no, that's never okay. And so you'll know that that's not okay, because completely stopping levodopa, especially if you've been on it for a long time, can lead to rebound rigidity that can actually be pretty dangerous. So is it okay if they make small reductions if I'm delirious and hallucinating in my levodopa? Then yes, that is okay. But oftentimes I would want them to, contact me to ask me, what I recommend, or at least consult the neurology team to see what a small reduction is. Some people don't know what a small reduction is. And so Always just contact your neurologist's office. If you do end up in the hospital, bring contact information for your neurologist to the hospital. Ask your medical team in the hospital how your neurologist can contact them. And this has been so helpful for me on the end of just trying to get in contact with hospitalists, right? A lot of times a patient will provide me the name because sometimes it's not actually clear in the chart who is actually taking care of you. And it's then me communicating with the patient, knowing who's taking care of them and how to reach that person. So you might have to be that go-between. You often are that go-between, and it's really helpful. Again, Emory visitor policy was just updated in October 2020. And I think this was generally from the realization that such a restrictive visitor policy without anybody that can be actively involved in the patient care has been pretty detrimental to certain aspects of care for various types of patients. So how they updated it is that instead of just having a blanket visitor policy with restrictions on these visitors, they now have another classification of a care partner that somebody can designate, certain individuals can designate upon hospitalization to be actively involved in their care. So not just a visitor, but actively involved. Okay, and so these are people, they don't necessarily have the authority to make healthcare decisions, but they can be involved in all the major discussions of the health care of the patient. Okay, and what kind of patients at Emory can request these care partners, okay, which have to be actually approved by the nursing team and the physician team of the hospitalized patient. So end of life and palliative care patients can request this. Inpatient obstetrics. Some of this obviously is not really super applicable to our population, but I've bolded certain things that may be. So patients with behavioral mental health difficulties. So obviously this could refer to a lot of our patients with Parkinson's, particularly if they are delirious. And so definitely, or being admitted for acute change in cognition, right? This could very well be your situation, and it's often very helpful to have a care partner in that regard. And then patients with communication barriers, which could also refer to some of our patients, but also patients who just need a lot of functional emotional support, right? And that could also be a fair number of our patients. And, you know, I talked to one of our recently hospitalized patients, and the care partner at least was able to come and spend the night. So they just have a little bit more, they have a lot more active role in the patient's care. And this is my last slide. So, and you're going to get a few more resources coming up in the next talk with how to advocate for yourself, but advocate that your care partner be allowed to stay. So if you do get a care partner approved, advocate that they be allowed to stay overnight or be allowed to come in and keep you grounded, right? This is a delirium protection measure, you know. Some hospitals, and I researched a little bit and was not exactly able to determine exactly what Emory allows you to do, and it may differ from hospital to hospital, but ask about care partners being able, or yourself being able, to administer your own medications. Now, this often creates a liability, and this may not be possible, okay, but just ask about it and see what the policy is. Distribute education material. Again, you're going to get some materials to be more empowered on that front. Ask your medical team to contact your neurologist. Can't say this enough. Even if they don't, just contact me yourself. You know, you can. Many of our patients just call the line, or they have care partners who are good at the patient portal, and just let me know what's going on, you know, and it can kind of help you through the process and reach out to your team, especially if they're at Emory. And insist that changes to your Parkinson's medication be discussed with your neurologist unless it's an emergent situation. I really like this one because not many people are familiar with changing medications. Advocate for early initiation of physical therapy. And just know that if you feel like you're not getting the appropriate care or you're getting dismissed in the hospital, there's always a charge nurse, there's always a patient release relations team whose job is to kind of bridge those communications, and that's always should be a resource for you if you need that. So with that, I am finished, and I'm going to pass it over to Heijen to give you some more information about being empowered in the hospital.
Thank you so much, Dr. Higginbotham. That was really, really informative, and I just very valuable information for everybody. So now it's my pleasure to introduce Heijen Ban. Heijen has been a social worker for the last 20 years, concentrating on community education and outreach for various organizations. After her father was diagnosed with Parkinson's 5 years ago, she joined the foundation as an Aware and Care ambassador to help people with Parkinson's advocate for themselves during planned and unplanned hospital stays. Currently, she works for CareLift in Metro Atlanta, and she provides support and resources to care partners who are taking care of family members at home. So, Heijen, we're very excited to have you here today, and look forward to learning a little bit more about what the Parkinson's Foundation has to offer in the way of resources and support for patients and families. So, Heijen, take it away.
Thank you, Annie, for the introduction. Thank you, Dr. Higginbotham, for a detailed presentation. Today, I think Annie and Dr. Higginbotham gave us pretty good picture of what would be like to be hospitalized, planned or unplanned, especially at this time of COVID-19. Today, I joined this part of presentation to share one way to prepare for the hospital stay. Have you seen this bag? I'm not sure if you can see it from my screen. Yeah, this is the actual bag. Or do you already have one? Next slide, please. Aware and Care, on top of all the resources that the Parkinson's Foundation has created, the foundation launched a campaign called Aware and Care. It's not only for the person with Parkinson's or care partner family, but it's also for the healthcare providers like the doctors in the hospital, the nurses working on the floor in the hospitals, or your primary care physicians, pharmacists, or hospital facility staff who just work in, whether it's medical or non-medical, but working in the hospitals, like social workers, case managers, or somebody who just bring in the food for you, anybody. So we said the Aware and Care is for everyone. Next slide, please. So what's in the kit? Today I'm gonna share you the goodies. I call this like Parkinson's goodie bag. Goodies that it comes with the kit. There is this bracelet. I know that many of us are very used to seeing people with diabetes wearing the bracelets, but the foundation have one for you, the people with Parkinson's. It basically says the Parkinson's disease alert, see wallet card. And we also give you the medical alert card. So you can fill out the information and fold it and keep in your wallet. So just in case, if anything happens and you're not able to respond to a situation quick enough, the card will say that I have Parkinson's disease, which could make me move slowly and have difficulty standing or speaking. I'm not intoxicated. Please call my family or physician for help. So there will be a contact information on the back and has a little chart of all the safe medications that you can take and the ones that you need to avoid. And also, before I go on, next slide, please. Before I go on, I wanted to let you know how to get all these goodies. All the information that's printable online are free. You can just print it out and use it. And we have something called Aware and Care Packets, which has like 2 medical wallet cards that I showed you, nurse fact sheets, and medication form sheets. They're all no charge. You can just go into our website and order them. And the kit actually comes with all the packets inside in here, but it's free, but the shipping is $8. So you can just look through it at the foundation website and pick what you need. And the printing are all free. So we really encourage you to just print the information and keep it for your can keep it and get it ready for any hospital visit that you might have. Let me go over a couple of stuff that we send you in the package. Next scan, please. The one we call it is the fact sheet for nurses. It comes over with a tear off pad. So don't be shy. You can just tear it off and hand it to everybody who walk into your room while in the hospital. Even though we call it like fact sheets for the nurses, it's for everyone. So if you want to just talk about Parkinson's or the symptoms that you have with the conditions, you just can share this. This one has very clear information about the medication, what to avoid, what to save, what is safe for you to take, common symptoms, or you can check off on the back, you can check off all the symptoms or the motor or not motor symptoms of Parkinson's and typical medications that you take. Like Annie and Dr. Higginbotham shared, not many people are very aware of Parkinson's disease. Like I have been a medical social work for last 20 years. And when my father was diagnosed 5 years ago, I literally had to educate myself about the disease and how to take care of my father. And also, for example, when people think of Parkinson's, everybody think of a tremor. Everybody think that all Parkinson's come with a tremor. But my dad doesn't have a tremor, but he also freezes very often. So people might not look at him as a Parkinson's patient because he doesn't shake a lot, but he has a freezing episodes too often, which is very dangerous. And it takes me a few seconds to speak up after the freeze episodes, and it's a very high fall risk. So it's very important that you keep this information and share with anybody walk into your door in your hospital room to let them know, not only for yourself, but for anybody who will come after you with Parkinson's will get benefit from this. Oh, I forgot to tell you about the little magnet that comes with the kit. So whenever you have this sheet or the medication form, you can just stick it in hospital rooms. All that I've been to, there is metal board that you can stick these sheets. So you can stick them up. So if anybody walk in, they will catch it and say like, oh, what is this? And they might get some extra education about Parkinson's. Next slide, please. The medical order card, I already share it. So next slide, I wanted to, next slide, please. I wanted to just remind you about the medication form. Oh, no, before the medication form, please. Okay, thank you. This is also, you can download it and print it. Everybody, this has like very basic contact information and basic information and the medication list. You cannot, I'm so sorry to say this, but you cannot assume that everybody knows what you're taking while you're in the hospital. I mean, I'm talking about the medication. So I want you to write down the medication and also stick it on the board. So if they walk in, they will know what you're taking. And on the back, there is a special consideration. You can check off whether you have the pump or you have a trouble swallowing. I mean, these should be in your charts, but there might be some people just rush into your hospital room as a clinician, but might not have all the information about you or the symptoms you have because of Parkinson's. So it's very important that you keep this. And also, please, like Dr. Higginbotham mentioned, update your medication form. You can just write it one time and just forget about it, put in the kit. Next time you end up in the hospital, the medication that you had here when you filled it out a month ago might not be up to date. So please keep it update. Next slide, please. Oh, and this one comes with a kit. And I really like this action plan book. It's like a little manual that it comes with any electronics in your kitchen, or like, these days people order furnitures and they come with the boxes with the little step-by-step manuals. So this book has great steps that you can prepare yourself to make a package for the kids or any hospital stay, whether it's planned or unplanned. So let me go over a couple of things that share you share with you a couple of steps that's in the booklet. Next slide, please. Step 1, pack your goodie bag. You know, we want you to fill out everything, every single thing, and keep it up to date and put in your kit. Step 2, find a good hospital. I mean, we all wanted to believe that all the hospitals that we drive by in our community are good. However, you need to do some research and find out which one of the good hospitals, which one is the best for you. First thing that I check is to see if my primary care physician is affiliated with that hospital. Like Dr. Higginbotham mentioned that, you know, it's good to have your neurologist or your primary care doctor affiliated with the hospital, because these days when a doctor is affiliated with that medical center, he or she can access your information digitally from their office. So they don't really have to go and see you, but still they will have all the updates about the care that you get. Second thing that you might want to check is if that particular hospital that you wanted to go in case of emergency or any procedure, just make sure they accept your insurance, because these days it's very complicated, and especially if you have a private insurance, you just want to make sure that particular hospital that you like to go accept your insurance. Next page, please. Step 3, be vocal. I'm not talking about like, you know, yelling and screaming on top of your head. I'm talking about be persistent with your request. Do not assume just because somebody walked into your room with the scrubs and white gown does not mean that he or she knows about your condition with Parkinson's or something, or just Parkinson's in general. You are there you have to let them know. And if you don't feel like you are being heard, just ask for a patient advocate. They come with different names. Some hospitals call them case managers or social workers or patient liaison. Just tell them that you wanted to talk to somebody so you can communicate better with their staff. And step 4, like the doctor said, get moving. As soon as your doctor said you can get out of the bed, start moving. But if they tell you that you have to stay in bed a couple of days, still keep moving. You can do the small movements. You can move your wrists, your ankles, you can stretch, you know, anything that and Dr. Higginbotham already emphasized how important it is to move. So I'm not going any further, but just try to keep moving. And one more thing is that I would like to tell you to take an opportunity to meet a new physical therapist, occupational therapist, speech therapist. Ask for them. Say, hey, I have a movement disability, so can you get somebody help me to get moving while I'm in the hospital? So I think that's something that you might pick up a few moves that you can take it home with you, and you keep doing it. Next slide, please. Step 5, stay on top of your care. Like Annie talked about the care team. It's a group of people who wanted to care for you. However, you need to be the captain of the team. You need to be the boss of the team. You need to tell them what your need is, and you need to understand what kind of medication you're taking, what kind of treatments you're getting, or what kind of tests you are getting done. And also remember the medication on time, every time. That's something that you really have to remember. After all the challenges that we talk about, I don't want you to get anxious or mistrust the hospital staff, but I just want you to confirm the care that you are getting and what you need to get while you are in the hospital. Step 6, follow and provide feedback. I'm so glad that Dr. Higginbotham emphasized that how she wanted to know what's going on with her patients. I know that your neurologist, your primary care physician really care for you, but at the same time, he or she has like 20 other patients that she needs to take care of at the same time. So give them a call and the office and let them know what has been done so far and what you need to get done after you get home. As I mentioned earlier, with all this data information sharing, if you give the permission to the hospital, they can just email you or electronically pass over the record that your primary physician or your neurologist will know what has been done while you're in the hospital. Next slide, please. This is my last piece, and I'm so glad that Dr. Higginbotham mentioned that at Foundation's website, there is a letter, hospitalization doctor letter. We usually keep a general one, but we just have another one, updated one for the COVID-19. This version of the letter will tell you basically how important it is for the people with Parkinson's against COVID-19, how we are more vulnerable with pneumonia and other conditions that might come with because of the COVID-19. So next time when you go and visit your primary physician in your list, ask them to just write their name and sign it. And here has the contact information for the doctors. And when you go to the hospital, ask your nurse to keep this in your chart. So when they have any questions about your condition, or they need to get contact of your doctor, they can just look up this letter in your chart and they can call them. Next slide, please. So when we all done, went through the booklet and packed your bag, what do we do? Well, very simple. We wear the bracelet and we keep the card in our wallet. And you bring this kit to the hospital. And please remember, it has to be updated whenever you make change on your medication. And let your family or your friend know where you kept this in your room. Because just in case, if anything happens and you end up in the emergency, you can just call someone and say like, hey, go into my room. There is this bag on right side of my drawer, get it and bring it. So whatever happens, whether you have to go to hospital, planned or unplanned, you will get your bag ready. And traveling, if you're like my mom, she loves this like, the Sunday through Saturday pill cases, different colors, you just snap open ones. But please keep your drugs, your medication, the original bottle with original label on it. Because the hospital will never allow you to take anything that's not with the original bottle. So you really have to keep everything. When you keep a set of medication in your kit, it has to be the original bottle with the doctor name and the drug name and the pharmacist contact information. And whenever you travel, we recommend that you have like twice medication as what you need. For example, you're going to visit your daughter and granddaughter for a week. Please bring 2 weeks worth of medication just in case. Put 1 week of medication in the kit and 1 in the luggage. Just in case you lose something, we want it to be safe. In Georgia, where I live, we don't get much of the severe thunderstorms, but over the weekend, we kind of got a taste of the storm Zeta. So this is good for that kind of natural disasters. We lost power for like so many hours over the weekend. This is where you can just grab it and hold on to it. Then you can start taking the medication from the kit. Whether you have electricity or not, you will know what to get and where to get it. And if you have, God forbid, if you have to rush out of home because of the disasters, you can just grab this bag and leave. Next slide, please. Okay, why did we start this campaign, Wearing Care? Because all the unpleasant situations or the stories that we hear at our helpline, we know that everybody there is to help you. We just wanted to make sure they are aware enough of the Parkinson's, so you will get the best care that you need. Next slide. Wearing Care is a national campaign, so there are ambassadors. We call ourselves ambassadors, over 100 ambassadors nationwide, try to educate the community, educate the clinicians, and educate hospital staff or the facility like a nursing home, long-term care, assisted living facilities staff. And we just want to share all this information with your help, because to let everybody know, aware of the Parkinson's, symptoms and aware of what we can help the people with Parkinson's to get better care, whether they're in or out of the hospital. Next slide, please. So if you are interested and want to share the information like I just did, just join Aware in Care Ambassadors at the foundation. They will train you, then you will learn a lot. And you can just join our group to educate everybody. Next slide, please. And the Parkinson's Foundation website was really like lifeline for me, because when my dad was diagnosed, I didn't know where to look, but from the foundation, I learned so much. So just go in, take a look, and you can educate yourself and everybody around you. Oh, did I mention how to order the kit? Okay, next slide will tell us how to order it. Next slide. You can just go online, call us helpline, and also the Care of Excellence in Georgia also carries the kits. So if you visit next time the Care of Excellence, you can ask for one, or you can contact Parkinson's Foundation Georgia chapter, or invite me to talk to your support group or group of people, because I can bring the kits to you too. Thank you.
Well, thank you so much, Hei-Jin. That was really, really, again, very informative. Thank you so much for being an ambassador. It's a volunteer position, so what you're doing is really amazing. And thanks to all of you. I know we're running a few minutes over, but I did want to see if we could ask Dr. Higginbotham. I know we've gotten this question asked several different ways now. I'm going to go ahead and stop sharing this. And again, yes, I do want to thank our sponsors again for making these programs possible. Dr. Higginbotham, I know this is a tricky question and it probably varies hospital to hospital. And I know that we somewhat addressed it, but I don't know if you could speak to this maybe specifically at Emory, but if somebody, say were to go to the hospital and request that they do get their Parkinson's meds on time, I need this medication at this time, how can they really ensure, and can they really ensure that they can get their medications exactly when they need it?
Yeah, this is a tricky question. A patient of mine actually asked this last week, and I wish I had a really well-defined answer for you, but the best way, right, would be if you're in control or your care partner who's there with you is in control of administering your medications, right? And so this is why definitely this policy is going to vary from hospital to hospital. And I actually couldn't really confirm exactly if there was a hospital-wide policy, because Emory has so many hospitals, on what they would allow. And even in the description of the care partners that they recently put out, was not able to confirm that this is a care partner, a guaranteed care partner task that they're allowed to do. But I would just encourage you to ask, especially if you're someone who gets your medications more frequently than every 6 hours or so. It can be very difficult for the nurses to do that. There is also sometimes, again, I am a little removed from the hospital, so I've been asking my patients a little bit about what's going on. But when I, was training, there was also ways that, maybe the nurses can even just put the medication next to your desk or the next dose, something you can ask them to do, so that when it's time, maybe it's not their medication rounds time, right? But you're going to need it in like an hour, and they can perhaps just put, in a little cup next to your desk or next to you. And so you could take it yourself. I mean, I think these are definitely things that you should ask.
And do you feel, and I know this question came in, if I don't have my care partner there to help me with this medication, administering the medication, making sure I'm getting what I need, does Emory, for example, have a form, that a patient can sort of fill out and sign saying, I'm going to administer all of my own medications while I'm here at the hospital? Like, do you know of anything like that exists?
I saw that question and I am honestly not sure. I honestly am not entirely sure whether there is a form that you can directly get access to. If there is not, I really, really would encourage you to see about your nurses often just like leaving the medication there at designated times so you can take it on time. And I would just, again, encourage you to inquire, but I did pretty much scour the new visitor policy just to see, and it's really hard for me to tell if this is a guaranteed thing.
Okay. Well, that's
Sorry.
great. And no, I mean, I think that's another perfect example of why everybody needs to download the Aware and Care information. I know the hospital action plan will really help patients and families navigate these questions, know what questions to ask, hopefully before you ever have to go to the hospital. You already have the answers that you're looking for, and all the materials and resources that you need are already ideally ready to go. So I think that's definitely all the time we have for today. Hey, Jen, Dr. Higginbotham, you guys were absolutely wonderful. To all of our attendees who stuck around, thank you, because I think the information hopefully you heard today was really important, and hopefully you thought it was valuable. Again, please call our helpline 1-800-4PD-INFO. To order your kit, to talk to them about, patient safety in the hospital. You can also visit our website, parkinson.org/awareandcare. Thank you again so much for being here today and for joining us. And please, again, join us. We have our PD Health at Home virtual programs. We actually have a program tomorrow, so please tune in for that. And again, visit parkinson.org/pdhealth for information on those. Thank you guys so much, and stay safe, stay well. And we look forward to seeing you at our next program.